We're joined once again by Dr. Shira Doron, hospital epidemiologist at Tufts Medical Center. Thanks for being here. I want to talk about Boston's mayor today saying that their public health emergency, that stays in effect partly because of that small antibody study, 750 residents. 90% had not been exposed to COVID, 1 in 40 positive but asymptomatic. So what do those results tell us? What does this mean?
Yeah, so this is pretty important information. So 9.9% was the number of Bostonians in the study that were positive for antibody. So that means that 90% plus of the people in this sample, and if you extrapolate that out to reflect all Bostonians, which it may not have been a representative sample, but it means that 90% are still susceptible to the infection. That means that as we open things up around here, we could still have a lot of people getting sick, ending up in the ICU and dying, unfortunately. The other piece of the study was that, and all of these people didn't have any symptoms, 2.2% were actually positive for active infection. And so that tells you what percentage of the population is potentially walking around out there with the infection, not knowing that they're transmitting the disease. So it's really important to know what proportion of people could be infecting others without any symptoms at all. And it really reflects how important it is to scale up that testing to a point where we could be testing even people without symptoms.
Yeah, it's such an important point. All right, so let's shift gears a bit and talk about vaccine. President Trump said he expects to have a vaccine on the market ready to distribute by the end of the year. But I want to talk to you about that. Is there a difference between having doses delivered, ready to go, and actually being able to give them to the public?
Yeah, I mean, there is a difference. There are many logistical considerations around actually getting them to the public. But I think the thing that we're most concerned about is how realistic is it to actually have the vaccine ready to go in such a short period of time? You know, we've never produced a vaccine in that short a period of time. It typically takes about 10 years to get a vaccine to market. I think the shortest one has ever been brought to market is 4 years. And there's just an element of time that's essential because once you give a vaccine in a study situation, you do have to wait some time to see if there are some long-term or late side effects. So I think we just need to be very cautious not to be overly optimistic about a vaccine.
It's such an important distinction. Okay, thank you. Some experts we're hearing are suggesting that it might not be a single drug that could successfully treat COVID-19, but perhaps a cocktail of several drugs, maybe the same way we treat HIV and tuberculosis. What do you think about that? And why might it take a cocktail of drugs to treat coronavirus?
Well, I mean, HIV and tuberculosis are unique in that they develop resistance so quickly, especially if you use only one drug. And that's why the cocktail is so important for those infections. That is not necessarily the case with COVID. I don't know that we have any indication that that would be true. There are clinical trials going on right now with one drug, and there are clinical trials that are going on with cocktails of drugs. I think the issue with cocktails is that if you have a successful clinical trial, you actually don't know which drug was the successful one, or does it require all of them?
Right. Okay. One more question. I want to ask you about testing once again. We're getting a lot of questions about the different kinds of tests. Can you just explain for us the difference between the two primary types we have right now? We have the PCR and the antibody tests. What's the difference?
Right, and the antibody test is also sometimes referred to as serology. So the PCR test is the one we typically think of as being the nasal swab or sometimes a throat swab, and the new technology that's coming on the market is the saliva test. Those are all PCR, and they tell you if you're actively infected right now. You may be infected with symptoms, or you may be infected without symptoms. Now, the PCRs do stay positive for several weeks. So if you don't have symptoms and you're getting the test today and it's positive, it could actually mean that you had the disease a few weeks ago, and it doesn't necessarily mean that you're still contagious. The serology test or the antibody test tells you if you've ever had the infection. And that's really more important right now for these epidemiologic studies like we discussed earlier. There's a fair amount of false positive rate in the serology test, the antibody test, where there aren't false positives in the PCR. And so you wouldn't want to overly interpret the antibody test as saying, I've had it, I'm safe, I can go out in public and not risk the disease, because that is not necessarily true.
Okay, Dr. Doron, thank you as always for your insight. We really appreciate it.
You're welcome.